Hey everyone, let's talk a little bit about use of Botox in the jaw muscles. Now to some of you, that might seem like a little bit of a crazy thing, and to others of you, it's a hot thing that you've been looking for someone who knows how to do it because you're hearing about it. I actually have to laugh a little bit when I think about Botox for the jaw muscles because many years ago, I was in a meeting with the senior researchers at Allergan who were looking down the road at new uses for Botox. And there was a small group of physicians, and we all felt that using Botox in the jaw muscles was a really important application to explore. And the scientists at Allergan said, there's no way that's going to become popular. We just can't imagine that. And several years later, we've now performed 2 clinical trials on Masseter injections with Botox, and very soon we're going to see Allergan being able to actually advertise this. So things have really come full circle when it comes to jaw injections. There are 2 main reasons for injecting the jaw muscles with Botox. One reason is for facial shaping. The jaw muscle can be very prominent in some people. When you bite your teeth together, you can see the jaw muscle pop out, and some people actually have a square type of jaw because their jaw muscle is so prominent. Now, some people like that contour, and that's okay, but by the same token, some people would like their face to look more slim. So one of the reasons that we use Botox in the jaw muscles is for slimming the face. Another reason to use Botox in the jaw muscles, the main other reason, is to relieve the symptoms of clenching and grinding of the teeth. Now, some of you who don't clench or grind probably can't relate to this, but for people who do, it can really be an issue. People who clench and grind their teeth will often break their teeth. They'll grind their teeth together at night so loudly that their partner stays awake and can't even sleep in the same bed. There are other times when people are so sore and have so much pain from grinding that they really have a tough time getting through the day. We often will see patients who've seen dentists, they have mouth guards, and they've often chewed through their mouth guards, they've tried acupuncture, they've tried all these different treatments, none of which have been very successful. Botox is a great treatment for relieving the discomfort associated with people who clench and grind their teeth. Botox is a great treatment for people who have symptoms related to clenching and grinding their teeth. One point that's really an important one is one about TMJ, or temporomandibular joint syndrome, and jaw muscles. It's true that people who clench and grind their teeth can have TMJ symptoms. TMJ can be a complex disorder that has multiple different causes, of which the jaw muscles may be one. I like to make it clear to patients that I am not a TMJ specialist. So if someone comes to me and says, my primary issue is I have TMJ, I usually suggest seeing a TMJ specialist first, who's usually either an oral surgeon or a dentist. Now, if Botox is recommended as part of treatment for TMJ, I certainly can do that. The vast majority of the patients I treat with Botox for their masseter muscles are either trying to pursue slimming of their face to get a more feminine appearance to the face, or clench and grind their teeth. One important note to be aware of is that injection of Botox in the jaw muscles is actually fairly tricky. When it's performed well, it does beautifully and the results are outstanding. However, it is really important to find an injector who's very experienced, because with inexperienced injectors, you can get the smile being affected, you can get ineffective treatments of the jaw muscles, incomplete treatment of the symptoms, and just not a great result. So do your homework, make sure that you find someone who's really experienced, who understands the anatomy of the jaw muscles, but think about Botox in your jaw muscles if you're interested in either slimming your face or treating symptoms related to clenching or grinding your teeth.